We all think we know what fraudulent medicine looks like. We all believe that we can recognize magical thinking when we see it. In developed countries, we don't believe that evil spirits or curses cause disease. We understand germ theory. Many people in the developing world still believe in these things. Psychic surgery, exorcisms, and other snake oils are considered real medicine. These beliefs lead to poor health outcomes. To people in the developing world, this is real medicine and is broadly accepted. How do our beliefs compare? What do we believe? What should we believe? These are all important questions. Homeopathy in the United States is a $2.7 billion a year industry. Homeopathic remedies are sold in your pharmacy right beside actual medications. Homeopathy is based on the premise that like cures like, and that the more dilute a medication is, the more effective it is. Its basic tenet is that if you have abdominal pain, find something that causes abdominal pain and then dilute it with water to an extreme extent. To such an extreme extent that there may not be a single molecule of the ingredient in any given bottle of the remedy. Somehow the water molecules remember being in contact with the ingredient and pass the benefits on to you. These bottles of water are then sold for crazy money. Acupuncture is a $2.9 billion a year industry in the United States. Acupuncture is an ancient Eastern medical technique based on the premise that your body has a life force called qi. Imbalances in your qi can cause many types, if not all types, of diseases. Practitioners believe that you can correct these imbalances by inserting thin needles into the skin at specific points on the body. This diverts energy from one place to another, fixes the imbalance, and cures the disease. Chiropractic is a $6 billion a year industry in the United States. It is so popular that many health insurance plans often cover its use. Chiropractic is based on the belief that many diseases and pathologies are caused by subluxations, or tiny misalignments of the vertebra in the back and neck. It is believed that chiropractic adjustments, which are sometimes violent, manual manipulations of body parts, including the neck, can fix these alignments and cure disease. All three of these practices have no solid scientific evidence for their effectiveness. In study after study, these treatments are indistinguishable from placebos. Acupuncture works just as well if needles are placed randomly. Homeopathy works just as well if patients are given pure water. And chiropractors have no effect above and beyond a massage therapist. These practices all have risks associated with them. Acupuncture can cause infections when needles aren't sterile. Chiropractic manipulations of the neck can lead to stroke. Even worse than direct harm, these practices drive patients away from seeking actual medical advice from trained physicians who practice science and evidence-based medicine. These practices divert resources away from developing new effective treatments and from expanding access to existing treatments. We need a movement to educate people. We need to support the use of science-based medicine and guide people away from pseudosciences. We need to prevent the snake oil salesman from taking advantage of the most desperate sections of our society. These charlatans affect all levels of society, from the poorest parts of rural China to the most famous celebrities in the United States. No one is immune to their charm and promises of wonder cures for whatever ails you. We can make our health systems better and more efficient, but it will take a commitment to science and evidence-based medicine.